common billing errors. So, yeah. So what we want to do with this section is just walk you through claim statuses of rejected and denied, so you understand how those processes work. What are some common reasons that you may receive rejections or denials? And then what is your process? So when you receive a rejection or receive a denial, what are your next steps? And what might be your recourse for those particular rejections or denials? Okay. I think someone over here asked the question, but I don't think he's there anymore. But they asked, what's the turnaround time? So the MCOs are contractually required to process 90% of clean claims within 30 days and 99% of clean claims within 90 days. So that's the general turnaround time. Now, a clean claim means that it's that they can actually move forward with processing, so that it's on the proper form, it's the right member, it has the auth, it's a covered benefit. So that's the definition, the HFS definition of a clean claim. So once you have a clean claim, then it moves into these contractual requirements. So the one thing I want to point out, which can be confusing, is process claim does not equal paid. It could be denied, it could be pended. So you'll also hear the word adjudicated. Adjudicated also does not mean paid. It means that it made it through to the claim system and it went through the claim system for processing, but it could still deny at that point, or it could pay something. But I just want you to be sure that you understand that processing and adjudication does not equal paid. And so that's why it's really critical that you have those checks and balances so you know what's getting paid, what's getting processed, and what's not getting processed. That's critical. So now I'm going to talk through one of the most confusing things that happens with a claim is the difference between a claim rejection and a claim denial. So I'm going to start with rejections. Do you folks use clearinghouses? Anyone in here use claim clearinghouses? Okay. All right, so a claim rejection, the easiest way for me to explain this is a claim rejection means you're going to get communication from your clearinghouse. So it can happen in two places. It can happen direct from the clearinghouse, or it can happen from the MCO to the clearinghouse. But the fact of the matter is, if the clearinghouse is giving you communication about your claim not going through, that's called a rejection. And I'll explain why that's so important that you know that here in a moment. So those communications come through a clearinghouse. If the claim is denied, you're going to get that communication from an MCO in the form of what's called an explanation of benefits, which we're going to talk about later too. So communication about rejections happens from the clearinghouse. Communication around denials is directly from the MCO. So this is rather confusing, but I'm going to try my best to walk you through the claims process. So if you're working with a clearinghouse, the MCO tells the clearinghouse what they need on a claim in order for the clearinghouse to accept the claim. So the clearinghouse is a EDI provider who's electronically processing the claims. So the MCO tells the clearinghouse what they need. Then the provider submits the claim to the clearinghouse. The general checks and balances at the clearinghouse are the fields filled out? Is there a name on there? Is a data service on there? So it's just general information about the claim. That's what the clearinghouse is doing, like a little check on. Like, is this worth sending to the MCO? Does it have enough information to move forward? If it does not, you're going to get a notice straight from the clearinghouse. So if you're using a clearinghouse, you're going to get daily reports on what's accepted and rejected from the clearinghouse. Another tip, which I should have a little icon on this one, you need to check your clearinghouse reports every single day. Someone's nodding. If you don't check those, you'll be sorry, I guess. So what's important here is the MCO, if you're working through a clearinghouse and your claim is rejected, the MCO has no line of sight to that claim. As far as they're concerned, you never submitted them a claim because they have an intermediary that's saying claim isn't good enough to go to the MCO. So many times providers will go to the MCO and say, I submitted this claim, and the MCO will say, I have no record of that claim. And you'll say, I submitted the claim, and they'll say, I have no record of the claim. What happened is your claim got rejected before it got to the MCO, so they truly do not have a record of the claim, and your recourse now is your action step is to resubmit the claim directly through the clearinghouse, which we'll talk about here in a moment. So that's really important for you to know that if you're using a clearinghouse and you have a rejected claim, the MCO, it never flowed to the billing system on the MCO side. That's the way I like to maybe help you. Okay, so if, say it gets through and it's going to transmit to the MCO. So there is another high-level check that's done at the MCO before the MCO accepts it into their billing system. So this is just like that second layer of, so the first is kind of a general check at the clearinghouse, then it goes to another check at the MCO, and if the MCO rejects it there, you're going to get a notice from the clearinghouse again, okay? And it's going to say, it'll show up on your transaction report, and they call different clearinghouses call them the different things. Sometimes the daily report, your daily accepts and rejects report. It can be various things, but just make sure you know who's working that report every day, and that is a key to success. If it passes at the MCO side here, and the MCO says, okay, it's good enough, then it's going straight into the claims processing system, and now the MCO has record of the claim. I know, it's clear as mud. So here are some common rejection reasons. So these are things that, again, the clearinghouse will say to you on your report. The patient status is missing, admission type is missing, no diagnosis or valid diagnosis, a revenue code is missing. So again, these high-level things that are required on a claim for it to move into adjudication or processing. So this isn't an exhaustive list. These are just some of the top ones that the MCOs and the provider groups actually submitted as rejection reasons. So if you get a rejected claim from the clearinghouse, you're going to want to verify that the claim data is correct. They're going to tell you why it rejected on your report. But the key here is that you're submitting a new claim because, again, the MCO never got the claim. So you're submitting a new claim. You don't have to do anything different. You're just resubmitting a new claim, which is different than a corrected claim, which we'll talk about here in 1 second. So you're just submitting a new claim. And just correct the things that they told you were missing or invalid on the claim. Okay, so if you get a notice from the clearinghouse on a rejected claim, you're gonna want to submit a new claim back to the clearinghouse. Okay, so a claim denial, that's different than a rejection. So the claim denials mean they came into the MCO system, they processed them, and they deemed them unpayable for whatever reason that might be. Maybe your agreement says they don't pay for that service. Maybe there was an auth required that you didn't submit. Maybe there was service limits. You can only do so many of a service. So whatever that might be, the MCO determined that the claim is not payable. How you will be notified of that is what's called an explanation of payment, or an EOP. And it articulates for you why that claim was either paid or denied. So it has both on there. And I think I have a sample of that. So here are some common denial reasons that are different than rejection reasons. So authorization not obtained, place of service invalid, billed charges missing, member not enrolled. We've talked about that as the number one. TIN and MPIs don't match, so that was one Lindsay mentioned earlier. Those have to match. What's an impact? Date spans don't work for the type of service billed. So again, this isn't an exhaustive list. This is just kind of like the top 10 reasons that claims deny. So I think the EOP will actually give you detailed information. Now the EOPs are not standard, each, just as they have their own portals, each MCO has their own EOP format, explanation of payment. Some of them also call them remittance advices, or most call them EOP, but I think Molina calls them remittance. But it's gonna give you the details on the claim on why it did not pay or what paid. Those are each noted, each has a code next to it that tells you exactly why it didn't pay. So this is, I don't know whose this is. Some here might know, but this is an example. So it's gonna give you specific information, the actual procedure, the day, the charge, what was allowed, all that detailed information by member is gonna be on your EOP. And then they give you these codes, will tell you, here we go, payment codes. So it'll tell you, paid in full, denied, the service is not covered. So it'll give you that line, claim by claim. All right. Also in the IMHIP billing manual, what all the MCOs agreed to do is what we called an educational EOP, because some of them weren't as straightforward as you as providers would like. So this is an example of an educational EOP, so they actually have details on what each field means and why it's there and where to look. So as you contract with different MCOs, I would go out and understand what their EOPs look like and what information is on them and how to navigate those in your billing area. So we have one for each MCO has what we call an educational EOP. Because some of them just are not that straightforward. Okay, this I think is confusing. Okay, so these are types of actions, so claim denial, corrective action. So what you would do, so if it's, well, you guys have brought this up a couple of times, not enrolled on data service. So this is where there may have to be some more. So if you get that reason back, the member was not active for the data service, that's when you want to use the Medi system to understand what MCO they were active with at that time, and validate that information. This is also, I think someone had a question earlier where you may have to involve HFS and the MCO and understanding that enrollment situation. But in that case, you're just going to have to research the enrollment information. Time limit for filing has expired. So this is also why it's very important that you use your whole 180 days. The sooner you get that claim out the door, the sooner that you'll know if you need to have additional action. The 180 days does not change. So if you wait 2 months to submit your claim, you now only have 4 months for any recourse that you might have with that particular claim submission. If they come back, and so they have 30 days to process it, so now you're down to only 90 days left. Maybe they come back and say you need to do, I don't know. But in any event, you want to be able to maximize that 6 months because it won't change. They're going to stand firm on the 6 months. So get your claims out as soon as possible and then work those denials, those rejections. So if you get a claim rejected, don't wait another 30 days to resubmit it. Have a process in which you could submit it soon so that, again, you have that whole 6-month window that you're working through. Missing or invalid taxonomy, resubmit. So these are denials. So in the recourse for many of these is to submit a corrected or replacement claim, which we're going to talk through next. And that's different than when you got a rejection. So the rejection, you just resubmit the claim to the clearinghouse. For a corrected claim, there's a process in which you have to document that it's a corrected and replacement claim in order to get paid for that. So look, I'm right ahead of myself here. So a corrected and replacement claim is a replacement for a claim that was previously submitted. So if you submitted a claim and it came back with a denial because you had an inaccurate taxonomy code, for example, you're going to submit a corrected claim. But again, you still have that same 180 days to get this done. That's why that's so important that you're monitoring your payments on an ongoing basis. So You're going to file a new claim if the claim was never submitted. You're going to file a new claim if it was rejected by the clearinghouse, which we've talked about. You're going to file a corrected or replacement claim if you receive something on an EOP that needs changed. So for example, these are examples: invalidated service, modifiers, place of service. The EOP received and the claim was denied at the MCO for a billing error. Okay. So again, the EOPs really trigger that corrected replacement claim. And each MCO, unfortunately, has different ways that they want to receive corrected and replacement claims. This is something that causes a lot of confusion. When you submit a corrected claim, so say you submitted a claim and they didn't pay, they paid $100 of the $150 of the claim because one of the service lines was inaccurate. You have to resubmit the entire claim. You can't just resubmit one line that denied. You have to resubmit the entire claim. What will happen is they're going to take that, what was my example, $100? They're going to take that $100 back from you, which is confusing because you submitted a corrected claim. So they're saying, oh, the original claim that we paid, we don't have to pay that now. Then they're going to reprocess the claim, and then they'll pay out, maybe it's $150 when you originally only got $100. That really confuses the bookkeeping side of providers, and that's really hard to maintain. All the MCOs do it that way, so they're going to take it back and then repay it out. So you'll have to have the bookkeeping to be able to monitor those debits and credits. Trying to see if there's anything else on here that I didn't go over in my example. No. This is just in the manual, depending on if you're submitting a paper claim or electronic claim. We go into and give you the exact process and what you have to do for each scenario, so whether it's a UB or 1500. But you want to follow the directions to indicate on the claim that it's a corrected or replacement claim. And that's signified whether you're putting the 7 or the 8 or the 7 or the 8 here on type of bill. But I'm not going to go into like filling out the boxes, but in the manual, it'll go through for you the example on what you do for which scenario. If you believe that you've looked at your rejections, you resubmitted them, that claim is still denied, and you believe, like in your situation here, where she's saying like, I did what I was supposed to do and the claim is still getting denied, you'll want to work with your provider relations rep. They all have an escalation process and how to get situations resolved. And if you go through that process and you're still not where you want to be, each MCO also has a claim dispute process that you can follow to make sure that that there's a fair discussion on both sides. But if a claim is just processed incorrectly, you don't need to do a claims dispute. You just need to resubmit the claim or resubmit the claim or correct the items on the claim. Claim disputes is only if you get through the whole process, you've worked with your provider relations rep, and you can't come to some resolution, then you would go into the claim dispute process. Oops. All right, we've talked about the provider portals. Each MCO has one. Go on there, register. This in the manual, we also indicate for you what functionality for each MCO exists. So all of them have some different functionality. And some of you, it sounds like you've used these portals so you know better. Like County Care, you can't submit, that was a question earlier, County Care and Blue Cross, you cannot submit claims online and through their portal. The other MCOs you can. Let's see, what others? So you can check payment status in some of the portals, but Blue Cross's will only tell you if it's paid status, but the others will tell you if it's pending or denied and those types of things. So again, understanding what's available to you as a provider within those portals will really help you facilitate your operations to get the most out of them. All right. So that's a lot. It's a complicated section. questions that you might have on claim rejections and claim denials, EOPs, things of that nature. Oh, there's one back there.
Is there a statute of limitations on the dispute or appeal process?
I think for their dispute process, they all have a different way that they want you to submit the disputes, and you still have your 180 days. So that's, still why it's important for your timely filing considerations. But I'd have to look at, in the manual, it goes through each one's dispute process and the timing of each and where to send the disputes, but I don't know each one off the top of my head.
And what I would add to that is, again, we talked earlier about those Monday meetings. So if you continue to have these issues and you feel like you're just not getting attention from the MCO, send them along to or talk to your, either if it's Carrie for ICOY or if you have another association that you work with. They're collating those and providing examples, and then the MCO, some of them have their CEOs sitting around that table, and they resolve those issues, and the state holds their feet to the fire to say, I need an update by the next meeting, et cetera, et cetera. The other thing I would say is, we always want you, and the MCOs want you, obviously, to work through them. They want to resolve these issues. But there is a state complaint portal for providers, and it's for a number of things, not necessarily just claims. So if you really feel like you've escalated this at the MCO level, and you have to demonstrate to the state that you have done that, you can submit a formal complaint to the state, and the MCO has to respond within 30 days. So there is always that as a final recourse, but hopefully, those number of those complaints are coming down as we've started building these Monday meetings and these discussions around the table. So.
And the key to that portal is making sure you've exhausted your own attempts to work through their own escalation process and the MCO's escalation process. Sure.
Can you talk a little bit about the value of using a clearinghouse versus doing it yourself, and maybe if there's a threshold upon which that makes sense or doesn't, or what your reflections are on that?
Yeah, it's really volume-based, I would say. You can use a clearinghouse for other providers too, or other payers, not just Medicaid payers, so you'd want to evaluate just your sheer claim volume. The alternatives to a clearinghouse are submitting paper, which I think Lindsay talked about earlier. Some of the portals you can directly input a claim, but again, if you're doing that for, you kind of have to think through your own operational process and how you can withstand that. Like, how many claims could you really enter in a day in a portal versus if you used a clearinghouse or some type of billing service. Billing services are also a little bit different than clearinghouses, but similar, but something that you'd want to consider too. Yeah, I don't think that there's a true number, but it's more how your agency functions and how your billing works for your other MCO or other, whether it's commercial payers or what have you. So, but that's a definite discussion to take back to your agency for sure. Any other questions? Awesome. Oh, sure.
Just a clarification. So when you say were a couple MCOs that didn't accept through their portal, so that means you have to use a clearinghouse or some other type of way to submit that.
Or
That's
submit
what you're
paper.
saying.
Yeah.
Or submit paper. Okay.
Mm-hmm.
Thank you.
Yeah. All right, are we ready to transition to our panel?
Yeah.
All right.